Hello everyone, I'm Dr. Viswanath Aluru, attending physician in physical medicine and rehabilitation at Optimal Health in New Orleans. In this video, we will continue with our topic, good patient care. We were discussing about discharge process. I already mentioned a few things about the discharge. If you go back and refer to my previous video, in this video, I want to talk a little bit about the difference between a visit summary and a discharge summary. You have to remember that as a resident, the patients can get admitted to any service. It can be a medical specialty or a hospitalist service medicine, or it could be a surgical specialties, including general surgery, neurosurgery, orthosurgery, any other surgeries, or it can be neuro specialty or a pediatric specialty, or patient might be just in the emergency room for observation and get discharged home. So depending on where the patient is and where the patient is going to, whether the patient is going to home, or whether the patient is going to some other department, or the patient is going to some other facility like an inpatient rehab or a skilled nursing facility or an LTAC, an assisted living facility. So it is something that you have to understand where the patient is currently and the way the patient is getting discharged to, and why the patient got admitted in the first place, and what are the things that the patient need to know or does the patient need before the patient gets discharged to the next position. So whenever the patient getting discharged, whether it might be like an office visit or like an inpatient or an emergency, there will be a visit summary of the patient or the family member gets from the department. So the visit summary should involve all the important points related to what things the patient need to know regarding that visit. What are the precautions or the instructions that you have to tell the patient that the patient needs to follow when they go home or go to some other facility. The patient might need specific instructions. Sometimes we give a lot of information like patient education, handouts, this and that, and the important information gets drowned in that too much information, and the patient, the family member, they don't have time to go through all these tons and tons of papers that you give the patient. It is very important that the very on the top of the first page of the visit summary, you should have a clear instruction like bullet points or 10 points that you need to write. What things the patient need to know. Are there any wound care precautions? Are there any driving restrictions? Are there any activity restrictions with bedding precautions? Are there any other orthopedic precautions or bleeding precautions? What are the red flag signs that the patient need to look out for if they have to reach out for some immediate help, like calling any EMS or going to the emergency department? What are the important follow-up appointments that the patient need to keep up with after discharge? And those are the main things that the patient need to know that you have to put on the first page of the visit summary. And you also have to describe if there are any specific like dietary restrictions that the patient need to be on. Like for example, some patients, like especially neuro patients like stroke, brain injuries, other neuro patients, with some cognitive impairments, they might be on some modified diet, like a modified solid diet, modified liquid diet. Sometimes they might be on a peg tube feeding. You have to write very specific instructions and also tell the family member about all those changes. Sometimes if the patient is going home on peg tube feeding, then you have to arrange for the home dietary services so they can go home and help the patient with the tube feeds and all. If the patient is going home with a trach, or if the patient is going home with a Foley catheter, or the patient has some significant wound care needs, you have to write explicitly what are those wound care requirements. Or sometimes you might have to give some supplies to the patient and also arrange for home wound care along with home nursing, so they can go home and follow up with the patient, do the wound care dressings as needed. And that's another thing. And if the patient need to go to follow-up appointments, you have to make sure all that information is entered into the visit summary, who they need to follow up with, where they need to go, if they have to call someone to make amendment, what is the number they need to call. All these things might be on it. And we already discussed about the discharge reconciliation of the medications. It's also another important thing that you must do the day before discharge. What medications you are continuing, what medication you are discontinuing, any changes in the doses, duration of the medications, what lab requirements. For example, like for Coumadin, they have to monitor INRs. If they're having low hemoglobin, hematocrit, they have to monitor CBCs. If they're having some kind of infectious process, they have to monitor CMP, CRPs. So those are the most important things you have to arrange, and tell the patient, go over those things with the patient. These are the things that should be on the after visit summary, or so called AVS. That is something the patient will get on the day of the discharge. The nurses will give the patient, hand over all that information, so that they know exactly what to do, where to go, where to gather medications from, where to collect, what are the follow-up appointments. And it comes to a discharge summary note that you have to do after the patient get discharged. The discharge summary note is for the hospital, for your records, for any future reference, for billing purposes. You must include the reason for the visit, history of present illness, past medical history, and progress notes on a daily basis, like a summary of the whole stay for that visit, and also what was how the patient was managed, for different conditions, and what was the physical examination, vitals, and any labs pertaining to that visit or the discharge date. What was the condition at the time of the discharge. If you are like a rehab attending or rehab physician, resident physician, you have to mention the functional status at the time of the discharge, functional evaluations at the time of the discharge, and what was the patient is able to achieve during the stay in the rehab department. You also mention discharge medications, the discharge follow-up appointments, the discharge dietary, where the patient is heading to, what's the discharge plan. And you also have to arrange, because if you're a rehab resident physician, there might be some other things that you have to arrange. For example, all the DME equipment. If the patient needs some special equipment, that needs to be ordered for ahead of time, because it takes time for the company to deliver the equipment before the patient goes home. Any specific modification at home, like home modification, for example, the patient might need a ramp to get inside, or the patient's entrance need to be adjusted so he can fit the wheelchair, or the patient bed height need to be changed, or the patient bathroom need to be changed. So these are the adjustments that have to be made for the patient to go home safely. So these things take time, so they have to plan for ahead of time, inform the family member. These are the things that need to be changed. So with this, I'm going to end this video. We're going to come up with another video soon. Thank you.